Hello. This brief presentation will discuss how to use the Doctors of BC COPD Action Plan, which is a document that helps to guide COPD management as your symptoms increase or change, which may be the start of a COPD flare-up. It is intended to help supplement the discussion you have had with your doctor, nurse, or educator about using the COPD Action Plan. What is an action plan? An action plan is a document that you create with your healthcare team that helps you recognize when your COPD symptoms change and guides what actions you should take. Action plans are reviewed regularly to make sure that they are up to date. Action plans are divided into 3 color-coded zones, with each zone describing symptoms and management. A new action plan is formed when needed or when changes occur to your plan. Now you may be wondering, why should I have an action plan? An action plan helps you recognize a COPD flare-up as soon as possible. It tells you what to do when you have a COPD flare-up, helps you make decisions when your symptoms get worse, and helps you become aware of your baseline symptoms. Ultimately, an action plan helps keep you and your lungs as healthy as possible by becoming aware of your baseline symptoms, like your normal level of shortness of breath, mucus color, and amount of mucus. Also, it gives you the flexibility to start treatment on your own. The next few slides will explain the different color-coded zones of the action plan to help guide your understanding of how to create and use one for yourself. At the top of your COPD action plan, we have the green zone, which is where we want you to be as much as possible because it indicates that your COPD is well controlled and that you are not experiencing a flare-up. The goals of well-controlled COPD are that your breathing problems do not get worse, that your appetite remains normal, that you are able to exercise and do your daily activities as normal, and that you do not experience trouble sleeping, which are all outlined in this green zone. If you are meeting these goals, then you should keep taking your regular medications as prescribed by your doctor because this will help maintain lung health and prevent flare-ups. For easy reference, you should write out your COPD medications in this table. It is also important that you be aware of the triggers that may cause your COPD symptoms to worsen. Some of these are listed in the orange box, which include getting a cold or flu, feeling run down or tired, being exposed to smoke or air pollution, significant weather changes, as well as mood changes, like when you're feeling stressed or anxious. When you avoid or limit your exposure to these triggers, you'll be able to better manage your symptoms and experience fewer flare-ups. Now, if your COPD symptoms get worse, this may be the start of a COPD flare-up, and you move into the yellow zone of your action plan. While in the yellow zone, continue taking all your regularly scheduled medications listed in the green zone, including the as-needed reliever or bronchodilator. However, you will also be adding on and taking the extra medications listed here as indicated by the black box on this slide. Before we continue, it is important to note that the black boxes hereafter are simply visual add-ons during this presentation to highlight specific points, but are not part of your actual document. It's important to remember that COPD management is more than just medications. While in the yellow zone, don't forget that you can do things to help relieve symptoms in addition to taking medications. Some of these interventions include getting more rest, huff coughing techniques, or the pursed lip breathing technique that is refreshed on this slide for your convenience. Now, if you've taken actions to relieve your symptoms, like getting some rest, using pursed lip breathing, as well as taking the extra reliever or bronchodilator, and your shortness of breath does not improve, we take a step further by adding prednisone to your list of medications. After waiting the specified number of hours indicated by your family doctor or nurse practitioner, which is usually 24 to 48 hours after the onset of symptoms, take the prednisone as indicated by the black box here or as indicated on your prescription. Furthermore, it is important to note that the prednisone requires a prescription provided by your family doctor or a nurse practitioner. Also, if your sputum or mucus turns green, yellow, rust-colored, or bloody, take the antibiotic as indicated here or as indicated on the prescription after waiting the specified number of hours indicated by your family doctor or nurse practitioner. Again, this is usually 24 to 48 hours after the onset of symptoms. Like prednisone, your antibiotics require a prescription from your family doctor or nurse practitioner. If, after taking all the steps in the yellow zone and nothing's improved in 48 hours, seek medical care immediately. That can mean calling your healthcare team, such as your family physician, your nurse practitioner, or COPD educator. However, if the symptoms are urgent or life-threatening, call 911 or have someone take you to the nearest emergency department immediately. Now we move on to the COPD flare-up history section. Keeping history of when and how you are having COPD flare-ups helps your doctor and healthcare team better plan your treatment to support your needs as they change or progress. It is important to keep this information up to date because when various doctors are prescribing new medications, they don't always see your previous prescriptions, or they may need to prescribe a different class of antibiotic for future flare-ups. In this record, you can indicate specific dates when you experience COPD flare-ups. It is also important to keep track of what medications you took in the event of a flare-up. For example, did you take a course of prednisone? Did you take any antibiotics? And if so, what kind? Also, did you have to go to the hospital? For any questions or concerns you may have with your COPD or with your medications, you can contact the 811 phone line to connect with HealthLink BC. Nurses are available to answer questions 24 hours a day, 7 days a week. Pharmacists are also available through 811 from 5 p.m. to 9 a.m. daily. For questions during normal 9 to 5 business hours, you can contact your local pharmacy to speak with your pharmacist regarding your medication-related questions. However, if you're experiencing an emergency or you are in the red zone as shown in your COPD action plan, please call 911 for immediate medical assistance as HealthLink BC is not an alternative to emergency medical care. This concludes our COPD action plan presentation. We hope the provided information helps you better manage your COPD. Do not hesitate to contact 811 for any questions or concerns, and we thank you for your time and attention.